So we need to understand who will truly progress in their lifetime and who will not. And you can think of it, some of them are clinical markers like the IgM, hemoglobin, bone marrow biopsy, beta-2 microglobulin. In fact, we have those as a risk calculator online. Any patient can access it, any physician can access it as AWM risk. And you can then look up your own risk calculator and see if you are at risk of progression. And if you are, then you could potentially consider an early interception trial. And that's the hope for all of us to do. Now, the other thing is these are clinical markers, which indicate that it's only the tumor burden. So let's add to it the genomics and understanding clonal evolution. We know CXCR4 mutation is critical for progression. We know that wild type MYD88 is also a problem. We know that there are so many other genomic aberrations. And then we recently started to look also at the immune system and did single-cell immune sequencing that was presented by Romanos Pistophitis yesterday. And that shows you that indeed the immune system is altered as early as IgM-MGUS, and we need to really understand what causes this alteration in those patients and how to use it in our own advantage, how to harness the immune system to develop therapies that can prevent progression in Waldenström.